In this video, I'm going to explain how you can remember the function and location for the 3 types of cartilages, and at the end, I'm going to give a quick quiz to help you retain what I'm saying about function and location, and also to make sure you can confidently tell the 3 apart. Alright, so the trick is, you first want to try and tie the function to the location, meaning ask yourself, why does it make sense that we have this type of tissue that is specialized for this function in this area of my body? So, hyaline cartilage is a resilient cushion and it provides a smooth surface for movement. That is why it makes sense we're going to find it on the end of our long bones in our joints, so that when our bones are sliding past each other, it is a nice, smooth surface. Also, in a couple weeks, as you're learning the skeletal system, you're going to learn that as an embryo, your bones begin as hyaline cartilage, and then that cartilage kind of acts like a template, and it begins to die, and as it dies, it is slowly replaced by bone until the only hyaline cartilage that remains is on the end of your bone and also in your growth plates, which is the part of your bone that allows your bone to grow and get longer. That's not really anything you need to commit to memory right now. I'm just giving you a little bit of a preview for how this is going to come up in the future, but it's not really the main thing you want to focus on. I'd say start with just knowing hyaline cartilage is in your joints. We call it articular cartilage because articular is always related to a joint. And once you get comfortable with that idea, you can start trying to tack on the other locations. So we find it in our ribs and as part of our respiratory cartilages, not because it's a smooth surface for movement. I think in this case, the advantage is it's a little bit more flexible than bone, but it is still rigid. So when you breathe in, the air is going down your trachea. You don't want that to be floppy. You want it to be open so that you can breathe. But having a little bit of flexibility helps because although you can't see it from this angle, in the back, there's a little membrane that when you're doing a deep forced exhale, that little membrane pinches the 2 ends of this C-shaped hyaline cartilage together to kind of help force the air out of you. So as we can see, hyaline cartilage is the most abundant type of cartilage in our body. Next after that is fibrocartilage. The advantage of fibrocartilage is it is a shock absorber. So we find it in areas of our body that are subject to a lot of stress. So, namely our intervertebral discs in between our vertebrae and the meniscus in our knees. Because your knees and back, if you're jumping, whatever you're doing, most of the shock is going to get absorbed by your knees and back. As far as why it's in the pubic symphysis, my best educated guess would be for pregnancy. Fibrocartilage probably allows a little bit more expansion than hyaline cartilage would. Alright, the last most rare type of cartilage is elastic cartilage. Elastic cartilage is flexible, but it also maintains its shape. So we find it in our external ear, so if you bend down the top of your earlobe, it snaps back. That's because it's elastic cartilage. We also find it in this structure called the epiglottis. The epiglottis has the job of swinging downward like a little door when you are swallowing, and it covers up your air hole to prevent food from going into your air hole, and then it just snaps back. Now that we've talked about where we find the 3, you want to look at the tissues and really try and see the function. So this first one we're looking at that is nice and smooth, that is our hyaline cartilage. It looks nice and smooth. It makes sense. It is a smooth surface for movement. Take that idea of it being a smooth surface for movement to help yourself remember. You find it in your joints where we call it articular cartilage. And the second one, these little purple fibers we're seeing, those purple fibers, those are elastic fibers. If you can remember that, it makes it easy enough to know that this is elastic cartilage. It is flexible but maintains its shape, and that helps us remember we find it in the external ear and epiglottis. And this last one is fibrocartilage. These long fibers are collagen fibers. It is for shock absorption. So when I'm looking at this, I really picture downward compressive stress, just pushing down, and then I imagine you push it down and it kind of bounces back a little bit. All right. Now we have entered the quiz phase. I'm only going to say the function and location for the first time we see each tissue type. After that, you're on your own. I believe in you. You'll remember. So this example we're seeing here is fibrocartilage. And we know it's fibrocartilage because of those long ramen noodle-like collagen fibers. We look at it, we picture compressive forces pushing down on the collagen fibers. We remember it's a shock absorber. And that helps us remember we find it in our intervertebral discs. This one here is hyaline cartilage. Hyaline cartilage is nice and smooth and glassy, which helps us remember that we find it in our joint cartilage. And it is a smooth surface for movement. In this image, even though the stain is not the typical stain that we see that would stain it purple, these little fibers and threads in between tightly packed lacunae help us remember this is elastic cartilage. The fact that it is elastic cartilage helps us remember it is flexible but maintains its shape, and we find it in the external ear and epiglottis. So this is hyaline cartilage. This is an ultra close-up of elastic cartilage. Once again, tightly packed lacunae, little threads in between the lacunae. This nice smooth surface is characteristic of hyaline cartilage. So this is fibrocartilage. We can tell because elastic cartilage, you also have threads, but you don't see long, wavy, noodle-like threads. They're much shorter. Smooth surface with no visible fibers tells us it is hyaline cartilage. All right, so that is all the examples I have for you right now. If it was challenging to identify these tissues even, then that's a sign you really should not be working on function and location. When you're learning, you want to try to think, I'm learning in layers, meaning I'm not trying to learn every single detail about every single thing all at once. I need to create some kind of framework in my mind that I can add details onto. So for histology, really, you should just be learning the identification aspect of it first. Then you can start adding on function and location. All right, I hope this was helpful. Have a great day and have fun learning.